Welcome, everyone. I'm happy to be here with you, talking about holistic coaching and just really starting at the basics. So create some great learning, and happy to be here with you. And I thank you for your patience. Had a little trouble bringing the PowerPoint up where I'm at work. So just to check in with each other, we're going to talk about the scope and standards of nurse coaching, and really get into discuss the role of the nurse coach in the healthcare landscape and what that's looking like these days. So two things I wanted to definitely review is what is a nurse coach? Many times we hear of health and wellness coaching, leadership coaching, executive coaching, lifestyle coaching. So we're hearing many different types of coaches. And so nurse coach is a registered nurse who integrates the coaching competencies into any setting, environment, creating in that specialty area of practice. And you're really wanting to facilitate that process of change or development for an individual or a group to realize their full potential. And the nurse coach really is working within the whole person framework, using principles and practice, not only of competencies and as we get into scope of practice, but also from a mind, body, spirit perspective, also including the environment. So the full person. Nurse coaching itself, you have registered nurse, baccalaureate or advanced practice nurse, skilled in nurse coaching, really creating that purposeful relationship, focusing on being result oriented so it can be documented. We can see results and goals. It's a structured relationship focused on patient-centered care within the interaction of the healthcare consumer, the patient, or the group that you might be working with. And it's really based on the fact that for effective change, we're focusing on that first, it comes from within. That the awareness for someone to want to make that change first has to come from within before we worry about the exterior goals and things like that. So really focusing on the person's desire to make that change and that shift in their awareness. And we're really creating that partnership where the client is their own expert. So we're recognizing that as coaches, we're facilitating and partnering with clients as they identify what they find they need to change or want to change or to achieve. So it's really focused on their agenda, and we're the facilitators in that process. So I wanted to review the scope of practice for a nurse coach. So when we talk about the scope of practice for a nurse coach, we're really incorporating both the science and the art of nursing practice. And so from the science aspect, we're really looking at critical thinking, we're using evidence-based practice, we're incorporating theories, nursing theory. And then when you're focusing on the art of nursing practice, that's us using ourselves as our own tool, but through presence, our own self-awareness, intuition. And again, we might use some things within that coaching aspect, like relaxation techniques, imagery, mindfulness. So again, we're bringing that science and that art together. Also, for our next scope of practice within that, we're really looking at our values and ethics of holism and caring and moral insight. So this really speaks to our accountability, our responsibility within this coaching relationship, legalities of that, also recognizing within that we're practicing within a certain scope of practice. So we're not teachers, we're not counselors. So again, holding true to that value of ethics and holism within the caring partnership of coaching. And next, incorporating culturally relevant philosophies and paradigms to help support the client's achievement. So they're really moving toward their goals and paying attention to their culture and philosophies and how that paradigm kind of also grows within that relationship. And next, part of the coaching process or practice is recognizing that coaching interventions, we're looking at the cultural norms. We're also looking at how policies may influence patient outcomes. So depending on what we're using in that intervention and how this relates to a person's outcome and what they would like to achieve. The next one really speaks to honoring relationship between individuals. And this also includes the internal and the external environment. So as we talked about how we have to know when someone is ready to make that change, that has to come from within. So it's the same here. When you're honoring that relationship with someone, we're really looking at their internal environment. So what's going on with them physically, what's going on with them emotionally, mentally, also spiritually, and what's going on in that external environment. So what is their culture? What is maybe their work environment, the family that they're connected to, their family dynamic, the physical environment, where do they live? So really taking all of that into that's how we really honor this relationship between individuals, is understanding that there is an internal and external environment, and we're taking that into account. As we continue to move on with nursing scope of practice, this is a partnership. So when we think of nursing, for me at the bedside, as patients come to us in the hospital or clinical setting, they're seeking our care. But as you're coming at it from a nurse coach perspective, you're really partnering with the healthcare consumer or patient or the group that you're working with. And we're going to talk a lot more about this and how this nurse coach has really gained some great traction within the healthcare landscape. So it's really about collaborating. It's not us telling the person what they need. It's really understanding, listening, communicating with that person to see what they want to do and how do we partner with them to achieve that goal that they're looking to achieve. Creating a safe environment. So not only a physical safe environment through emotionally safe as well. So the physical environment, where is this coaching session taking place? Outpatient, hospital setting, clinic setting, in someone's home, in a private office, and then the emotional components of safety. And again, that comes down to laying that foundation of co-creating the relationship and the trust that you build within this partnership. And so being very much aware of this, learning about someone's, being open to what's happened in the past, if they've had past trauma, that trauma-informed care piece, again, when we talk about emotionally safe. And the next one, talk about integrating professional nursing and coaching competencies. So utilizing our scope of being a registered nurse and adding into that our knowledge and experience of utilizing the coaching competencies, how these both can be integrated to really support the coaching process, but they integrate well, and we have our nursing, professional nursing, that gives us the foundation and guidelines, and then the coaching competencies add into that. So really integrating both. And then using self-care, self-reflection, and self-development. And we talk about this a lot with holistic nursing, and I can't stress this enough. Nurses are one of the areas that sometimes we put ourselves on the back burner. And so as a nurse coach, what are you practicing for your own self-care? How do you use self-reflection to support your growth, continuing education, There's always parallels for growth and self-development for nurse coaching, and really being able to, walk the talk and talk the walk. Basically, that you're utilizing these things because first you have to know yourself as a nurse coach as well, and so that you can bring that to this collaboration, this partnership with the patient or client or the group that you are working with. And then using values yourself in the coaching practice. So really, what are you bringing? You are bringing your experience, your knowledge, your wisdom to this, to the coaching practice, and really honoring your role and the work and the dedication that you're bringing to this partnership. So again, keeping all of the scope and standards in mind, we're going to go through some of the core values for nurse coaching. And one of the first values really incorporates nurse coach philosophy, theories, and ethics. And the philosophy is supporting the who, the why, and the where of nursing practice, and really giving that depth to the practice of nurse coaching. We want to be theory guided, evidence-based, and evidence informed through research, through education, that really supports the role of the nurse coach, and adding value to this role for nursing. And we want to be guided through a code of ethics, which we use interpretive statements from the American Nursing Association, and that supports an ethical framework for nurse coaches. So we really want to be able to apply ethics and theories to our nurse coaching, have these things in place for us to support the coaching philosophy and the practice of nurse coaching, and know that we're coming from that holistic perspective. So that's really giving us some foundation. So when we go into the core value 2, nurse coach self-reflection, self-development, and self-care. So we talked about this previously, but nurse coach self-reflection really allows us to have awareness and insight, and allows us to gain insight as to what we are bringing to the table, but also what is going on with me in my life at this time, so that I have awareness. And that's why it's important to do self-reflection, because that ebbs and flows, that changes as we grow and change and practice different forms of nursing. So really, self-reflection is about gaining some insight and awareness. So valuable. Sometimes when I'm writing self-reflection, I'm like, wow, I didn't realize how I was really processing this. So self-reflection really invites us to slow down and see where we're at. And so when we do these things, then we are more present with the person that we're coaching with, when we know where we stand and where we are as a person, as a nurse coach. And of course, self-development, all about the learning, continuing to do education. It's lifelong learning, right? There's always opportunity for learning and growth. I'm really not surprised at how much I get to learn from other colleagues, from other nurses, holistic nurse coaches, on nurse coaching, but just in general. And so again, being open to self-development and all the opportunity that's available. So really, it's limitless. And that self-development is always there throughout our lifespan. And self-care. Many of you, I'm sure, practice some form of self-care. What are some of your practices? What really speaks to you for self-care? Not only, outside of work, but for me, I work in an acute care hospital. And so I try to be very mindful of practicing some self-care while I'm physically at work. before I go in to see a patient, or before I meet with a family, or before I meet with healthcare workers or other nurses. I'm trying to practice that self-care, not only while I'm at work, but also at home. So both places. And again, this is something that is important when it comes to working with a client as a nurse coach, that you can role model. So if you're doing these types of things, then you can model that for the client or the group that you are working with. And, we talk about how, you can't really pour from a cup that's half empty or half full. And, but it is very true. And I think, self-care still remains kind of the buzzword these past few years, for sure. And I think sometimes we might say it and not fully bring it into our presence. And so again, I really value this core value because it encourages us to look at ourselves. And I always found it helpful. I did some work in heart-centered hypnotherapy. And during that training, one of the things that came up was as learning to do that type of work from social work or psychotherapy as a nurse, was that you were encouraged to work on yourself first, and before you worked with someone else. And so these things really speak to me, and that I have to do my work too, in order to support holistic nurse coaching and what I bring to that partnership with someone. So, there's only 3 things listed here, and it seems like a very, kind of low slide, if you will, but the value, there's a lot of depth to this. And so I hope as you move forward, or you're considering nurse coaching, that you realize how powerful this is. You have to do your work first, and these 3 things support that. So the core value 3 talks about the nurse coaching process. And again, we're seeing that this is all mind, body, spirit, environment, emotional, mental. It is the full person. And so when we talk about establishing the relationship, part of that nursing process is the assessment, right? So here in this part, when we're establishing the relationship, we want to be fully present with ourselves and a client. So I know when I'm meeting with someone, that I pause and take some deep breaths, do something to allow myself to get fully present with the person that I'm working with. And also, this is where we begin to establish, what is it that the client wants to change? What is it that they want to work on? What is their agenda? And we understand from nurse coaching that this is ongoing. It's a dynamic process. And so, that might ebb and flow throughout the coaching sessions, and it might change up. So again, we're creating that foundation with the person we are working with. And then identifying opportunities. So issues, so this speaks to, diagnosis. So what are the issues that relates to the growth for the patient or the client? Also looking back, we really want to support and reinforce previous successes, focusing on that as well to support their growth, in addition to, identifying those issues. So lots of growth opportunities here. Next, we want to really look at, this is person-centered goals. And so this speaks to outcomes. So what is the overall approach? How do we facilitate achievement of the client goals? So what is it that the client would like to try, and how do we facilitate that? So part of this is, that little bit of unknowing, listening, communicating, and hearing what it is that they want to work on. When we talk about creating the structure of a coaching interaction, so this speaks to planning. So here's where we're establishing some parameters of the coaching relationship, setting some boundaries as well, establishing meeting times, depending on the environment and what the session is to be about, moving forward. So giving us some guidelines and structure to how we want this interaction and this coaching to move forward. And then holistic nurse coaching, I think, really speaks about empowering a person to reach their goals. And we talk about this as being an implementation phase, but nurse coaches we're using intention and we're using interventions to help the client achieve their goals. So here, this is where we can use deep listening, powerful questions, our intuition, many different ways of knowing to help someone realize their goals. And oftentimes, this is very empowering because in this relationship, I find that I have facilitated people really realizing they do have the answers within themselves. They just need some partnering and facilitating to bring it up maybe more to the surface. And so, it's nice to see those aha moments when you're working. I know it's nice for me to see those aha moments when I'm working with someone and they're like, whoa, okay, I'm getting this. And it's very empowering for someone to realize, wow, I guess I do know what I want. I can make this decision. So it really, the holistic nurse coaching really brings this out. And we know from practice, or at least in my experience as a bedside nurse, offering choices to someone is very empowering, even if it is a small choice. So coaching just really is really expanding on that. And that's why it's so empowering for a person, because we're really facilitating that. And when someone realizes that it really supports their strength and their wanting to continue to move forward when they feel empowered. I mean, when you feel empowered, I know it makes me want to continue on. I feel successful. So I think the holistic nurse coaching really speaks to this. And next, assisting a person to review which goals were achieved. So this speaks to evaluation, and depending on the environment that you're in, or how you've established your structure for coaching, how you're going to evaluate with the client. And again, just like we were talking about empowerment, this comes from the client. So this is done by the client based on their perception of success and achievement of their goals. So we're partnering with them to review the progress. And what does that look like for you? How does that feel? Or how did it feel? So again, using those open-ended questions, powerful questions, mirroring what they're saying, creating that space for them to process and review what's been going on with their agenda and meeting their goals. So it's really coming from the client, and we're facilitating that. Can't stress that enough, how important that is to really allow the process to unfold. So nurse coach communication, and we know that this is very valuable. And I'm going to also say not only with the client, but how we interact with a multidisciplinary team, how you communicate with others, colleagues within the coaching realm or within your clinical environment, or maybe you have a private practice and maybe you have to connect with community resources. So again, how are we communicating outwardly to the community, I would say, also within this relationship of nurse coaching and understanding that communication as while we're listening, and sometimes we get caught up in, there's got to be constant dialogue. And nurse coaching, holistic nurse coaching really speaks to that listening and being present and that nonverbal communication, that eye contact. So not only, what is said, but also what is not said. So paying attention to that, to those verbal and nonverbal cues from a client, how we are communicating outwardly into the community, how we are communicating with the client, and also that very impactful listening part of communication that we do as nurse coaches. Again, this really supports a therapeutic relationship. We're creating that environment, which speaks to healing environment. So within that framework of a healing environment, creating that therapeutic relationship, the trust begins when you begin to establish the foundations of the coaching relationship. So partnering with clients, partnering with groups to help make change, but really how we are supporting them within the dynamic of a relationship, of this coaching relationship, to support growth and well-being. And the healing environment, we've talked earlier about that it is also the emotional environment as well as the physical environment. So I always think of Jean Watson and her 10 character factors, because it talks so much about the healing environment and what that looks like, what it feels like, and creating that. So being able to focus in on that during the coaching session. And how do you do that? For me, I'm in a clinical setting, I'm in an acute care hospital, and sometimes it can be very difficult. If I'm at the bedside with a patient and a family and they're not in a private room. So I'm very mindful of that. Privacy, trying to pull the curtain, things like that, so again, talking about that physical environment, and then emotionally, making sure that I'm sitting, making that eye contact, establishing that trust. So that also promotes that emotional safety as well. And then culture of care. So considering the effect of one's personal values, our culture, our spiritual beliefs, knowing about our own experiences and biases. And that speaks to therapeutic relationship, in that we have to be aware of our own biases, right? And how that can come into play. When we're establishing this therapeutic relationship and this communication, being aware of our own biases, and not being judgmental. We create a lot of things sometimes in our head when we first meet someone, so have to be open to allowing that process to unfold, and being aware of that. And again, that goes back to our own self-development, our self-reflection, and our self-care. So again, all of these things I feel really are integrated and build on each other, and really help us to stay in that role of holistic nurse coach, and really creating such a great opportunity for someone to support their own well-being, to see their own growth and well-being. So as we talk about nurse coach education, this was a big one for me, from fixing to being. And I now have, for a long time, I was the only nurse and medical person really in my family. And now I have a niece who is a nurse. Um, so many of my family and many of my friends would come to me and ask me um, different things. Rose, what's your opinion on this? What should I do about this? What should I do about that? And I was always willing to help them fix, and I'm saying that with quotes here, fix their issue, tell them what to do, lead them. And when I took the nurse coach program, um, I really had to take a step back and realize, I don't have to give someone the answers. I don't have to lead. And so this was my aha, that through developing my communication skills and really doing that deep listening and asking those powerful questions, I really kind of transitioned from that fixing to the being. And so this was quite a large thing for me to learn when I was going through the education for nurse coaching. And so just to be aware of that, that's why I love this, because sometimes when we speak of, or at least in my experience, what I have noticed is if I have a patient that goes to, they go to a nutritionist and they need to work on, they're diabetic and they need to speak to a, nutritionist and about their diet. And the nutritionist, normally say, well, these are the things you need to focus on, the meals. They might give them recipes. They might even give them a whole schedule of a month of meals to prepare and things like that. And there might be some options in there, but again, there's no real coaching in that, right? There's just, here's what we're going to tell you to do to fix this, to, maybe make this better. So that's why coaching is so invaluable, because you're really partnering with someone. But again, so this was a big thing for me when I was learning coaching, and to really kind of take a step back. But we also want to know that there's many programs in education. So you want to pursue professional nurse coach certification. This is how we demonstrate, competence, and it promotes the nurse coaching role, and how we communicate and promote that holistic nurse coaching role to the public, to the healthcare community, and to the client person that we're working with. So really having that professional certification enhances the practice. It validates it. And we're really using competence to integrate knowledge, skills, abilities, and formal and informal reflective learning experiences to support our education and growth in holistic nurse coaching. So again, really paying attention to, there's many different coaching programs out there, but you really want to focus on ones that speak to nurse coaching. And then also part of this is nurse coach research. So we really want to be asking researchable questions. How are we partnering with colleagues to design and implement research? We're going to talk about this shortly, within that healthcare landscape, where it is, what it comes down to when we look at the reality of funding and programs, things like that, you need to have the data. You have to have the statistics. You have to have ways to evaluate. So in this coaching process, part of the holistic nurse coaching process is, that we are doing things that are measurable, that we have outcomes, and that gets documented. So research really is valuable, because we know that it is needed to support that, to support the role of the nurse coach. We want to have and develop strong information for our literacy skills. We want to effectively utilize high quality resources. So it really continues to define and represent the value of the holistic nurse coach. So keeping that in mind, that we do have to make sure that we incorporate that data and we can speak to the data. So in the healthcare landscape, nurse coaches, so we see nurses as coaches. There are a large amount of staff nurses. We have nurse managers. So there's some descriptive characteristics of certified nurse coaches. So some practice as nurse coaches, some are staff nurses, nurse managers, others are educators, other nurses work in case management or clinical nurse specialist, also maybe in staff development. But we see nurse coaching in private practice, in the hospital environment, can be an outpatient ambulatory clinic setting, school nursing. You might see nurse coaching within a community agency or government agency. Also, different industries and businesses use nurse coaching, and insurances. So the healthcare landscape is broad for nurse coaching, and there's many aspects of nurse coaching that can be utilized within the healthcare landscape. So we know that the healthcare landscape has changed significantly these past 3 years. We see that there's a decrease in staffing levels, not only in nursing, but allied health. And just according to the source from the Bureau of Labor Statistics, currently in the US, we have 5.3 million nurses. Now, some of those are catalyzed, not all as registered nurses. They incorporate some other aspects of nursing. Worldwide, through the World Health Organization, last stated in 2020, there's 28 million nurses. So 9.3 million are professional RNs, 6 million are associate, and then the remainder they didn't really classify. So I'm also going to say probably there might be advanced practice, there might be midwives in that number as well. Also, and for the US as well, because they didn't break it down. But we know the healthcare landscape has changed, and we're using more technology. There's virtual aspects of the healthcare landscape that we're forced into doing because of COVID. So the setting and the environment may have changed a little bit, but the coaching skills of listening and communicating remain. Those foundations are still there, and connection and partnering with patients and clients and groups is still there. The future of nursing and other health initiatives also suggests that there's going to be a need for an increase in education and leadership. And nurse coaching actually is really strategically kind of in a good place to collaborate with clients and groups to really help evaluate goals, client goals and group goals, and to really be an extension of nursing to partner and support as the healthcare landscape continues to change. It really is consumer driven. It's a service that contributes to positive healthcare outcomes. And I'm not going to say wellness, I'm going to say well-being, because wellness, sometimes when we think of, I get well, I have an infection, I take an antibiotic, and I'm well. So the healthcare landscape, and I will say from my perspective, I am seeing and hearing more patients wanting to be more involved in their care. They want more options of, okay, I know I might need this surgery, but what else? What else? How do I make this surgery a success for me? So again, you can see how holistic nurse coaching can really partner and collaborate with a patient or a group in any part of this healthcare landscape. So as we talked about, the process of nurse coaching is very dynamic, right? And it's ongoing when you're working with someone. And that's how I see this healthcare landscape. And that's why I put the picture of the environment of just, the water flowing, the water ebbs and flows. There's many things to get through and over. There's many things in the landscape, just like there is in the healthcare landscape. And nurse coaching is really poised very well to support the dynamics of the changing healthcare landscape. And it's so very valuable as more people want to partner and be in their care. And as we see shifts of doing coaching virtually, or more patients being at home, cared for at home, or so it's just a myriad of options and opportunity for us as nurse coaches to really support a positive change in the healthcare landscape and be really instrumental in this. So just bridging the gap. So think of where you are in your practice as a nurse, as a holistic nurse, and maybe as you want to move forward to be a holistic nurse coach or nurse coach. So bridging the gap, again, I'm going to talk about your self-awareness. Where are you? What's working for you? What maybe is not working for you? Applying your own experience. What is your experience as a nurse? Can you move that forward or add in nurse coaching? How does the dynamics of that change or be enhanced? Partnering with other colleagues, learning from other colleagues, partnering with community folks, being involved, whether that's through community groups, local organizations. So really making yourself available. What is around you in community-wise, environment-wise, and where you at? And then education. And how do you want to move forward? What education speaks to you to support nurse coaching? What program are you looking at that fits your needs, that supports your growth? So again, bridging the gap, really integrating holistic nurse coaching into practice. And so I thought I would share with you two examples of, oh, you can go back. Thanks. I thought I would share two examples of some coaching that I have done here at the hospital, and incorporating these things. And so I worked with a colleague recently struggling with a decision pertaining to how to handle a work situation as it pertained to some leadership. And we already had a trusting relationship as being colleagues, but this person was coming to me for really trying to, they felt really stuck. They felt angry, stuck, not empowered, and were considering taking a week off of work to avoid, just avoid work altogether. And so through the coaching session, I really stayed with that presence of listening, asking some powerful questions, and created that emotional safety. This allowed the person to really talk about some options and experience and feel in her body how those options felt for her. And by the end of the coaching session, they were able to have a plan that felt comfortable, that felt right for them. And they made the decision to not take PTO, not avoid the situation, and they felt empowered because they were the one that came up with the option of what felt safe and what felt good for them to do professionally and personally. And so, and this person had past trauma in their life. And so things that were happening, this triggered some trauma. So again, being aware of that and really allowing this coaching process to unfold and facilitating their own awareness. She came up with what she needed to do in this process. And at the end of the session, she felt really empowered. And then another one, I was working with a colleague and whose mother was ill. And this person was really struggling with wanting to make all the decisions for their mother, what they felt should be done. And their mother was of sound mind, but struggling with end of life and her diagnosis. And again, it was all about creating that relationship, being present, listening, and allowing my colleague to express her feelings emotionally, talk it out loud, and process. And she was able to come up with, she was able to be supportive for her mother and respect and honor where her mother was at in her end of life. And instead of trying to say, no, I want you to do this, this, and this, she was able to take a step back and also gain some insight into her own anticipatory grief. And maybe that some of the grief was fueling her response. So again, through coaching, she was able to take a step back and really gain some insight in what she wanted to do. So she came up with a way to really be present for her mother and not add any judgment as to what she felt her mother should be doing. Really was able to be in that mother-daughter space, in that loving space. And so again, these weren't long sessions, but can really create that space for someone in a short amount of time. So I always like to bring this up because when we talk about holism, holistic nursing, holistic nurse coaching, I just like to share this. For me, it's a good reminder that holism comes from the Greek holos, which means all, whole, entire, in the idea that symptoms, whether they're physical, biological, chemical, environmental, social, mental, and their properties be viewed as whole and not as a collection of parts. And we do this very well in the medical community. We have cardiothoracic surgeons, we have oncology, we have nephrology, we have neurology, and a lot of times patients get pieced out, right? And I believe as holistic nurses and holistic nurse coaching, we're looking at the entire person. And this term was actually coined in 1926 by Jan Smuts, who wrote a book on holism and evolution and defined it as the tendency in nature to form wholes that are greater than the sum of the parts through creative evolution. So it speaks to Darwinism and Einstein's theory of relativity, but what he was really saying is that all of these parts create the whole, and you cannot have one without the other. And when we talk about mind, body, spirit, that's what we're speaking to that interconnectedness and recognizing that. And this comes very true for nurse coaching as well. And so, as Socrates said, for the part can never be well unless the whole is well. And I really think the scope and standards and the nurse process of nurse coaching really speaks to this. So nurse coaching and patient-centered care. I don't think it gets any more patient-centered care than the coaching process, right? that it's open and flexible. We allow things to unfold, the unknowing to happen, to create that space for it to happen with the patient or a group. We adapt to the situation, right? Whatever that might be and whatever needs to happen, we're flexible and open to that process. And it is all about co-creating. And in 1952, the nursing theorists Hildegard Pavlov and Dorothea Oram, they talked about, or they introduced several concepts that relate to nurse coaching. And one, they shared about recognizing and mobilizing the person's innate capacity for self-healing and growth. And that's what this is all about, right? When we're supporting and helping someone with their own well-being, it is the growth that they are experiencing that supports that self-healing, whether that's healing is physical, emotional, or spiritual. And we recognize that every person is unique being with the capacity to learn, to develop, and to change. And I think when we talk about patient-centered care, the theorists really speak to that, with that we're open to that people can learn, they can develop, they can grow, they can change. Of course, that has to come from within, but our role is there to support that, to facilitate it, and to help foster it. So I want to talk a little bit about the actual nurse coach certification. So the American Holistic Nurse Credentialing Corporation, also known as AHNCC, credentials the national certification exam in nurse coaching and holistic nursing. So they're the credentialing body, and they've been doing the nurse coaching since 2013. Holistic nursing and nurse coaching is a magnet recognized certification. It's a nationally accredited exam. It's based on the professional nurse coach competencies and the role delineation study. So saying that we have had nurse coaches and nurses participate in this, that this has value. And I will say having a magnet recognized certification speaks well. I work for a hospital that has a magnet designation, and we're up for our recertification. And this adds value and credibility. So I can't stress enough when you go to do a program that having the certification for nurse coaching. Now, you can be a nurse coach as a registered nurse and do the training and the education for a nurse coach. If you happen to also have your certification as a holistic nurse, as I do, then as a nurse coach, my designated credential is Health and Wellness Nurse Coach, board certified, because I'm also a holistic nurse. So I found that was very helpful, having my holistic nursing certification before I did nurse coaching. But that doesn't mean you have to do that. I just want you to be aware of the designation once you have both. Newly, this was a big, long process. Many nurses were involved, nurse coaches, AHNA, AHNCC members that really supported this to happen. Is in the last cube here is nurse coaches can now use CPT codes. At first, when they submitted the document, it was denied, and they resubmitted. So there was a lot of work that went into this. So nurse coaches can now bill under health and wellness under those there's 3 coaching codes that can be utilized. So I believe that has taken effect now. I have to, if not for 2024, but this was a long, arduous process. And again, it goes to show the value of nurse coaches and how important it is. Nurses remain still in the US, and I would even hence to say worldwide, one of the most trusted professions. When we add in certification, education, that validates our practice, it gives us more credibility. We just need to be continue to be at the table, to having these conversations, to communicating with other healthcare professionals, the multidisciplinary team, the community, even legislation. And so recognizing that this is a valued role, and I feel it will continue to grow and prosper within the healthcare landscape. So again, just recognizing we use all ways of knowing. Nurse coaching is mind, body, spirit focused. Environmental, we're looking at everything. So I just thought I'd put these affirmations in there because I like them and I thought I'd share them. So take what speaks to you and leave what doesn't speak to you. Mind, I am focused and capable of greatness. Body, I am healthy and take care of myself. My spirit, God is my ground and my center. So again, you know, it's all about what speaks to you when you're ready for change internally and externally. So I want to thank you for spending this hour with me. It's been great to share about holistic nurse coaching, and I wish you all a very peaceful day. So thank you so much.